Those of the hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Yes,
much better. Much better. We are on the air. Congratulations, Anita.
We are on the air.
Congratulations. Excellent expos yesterday.
Yeah, we had a great expo.
And,
thank you.
Again, we cannot be in two places at the same time to all our, people that wanted to see me there.
With the flu.
Well, yeah, I'm very busy trying to educate people with the flu and all of that. So while you were handling the expo, I was handling the other part.
But you know what made me happy? We had such a huge crowd and nobody was sick, which is actually wonderful that nobody was sick. So the people we attracted were the well ones.
Good, that's excellent.
Maybe they were all Dr. Mencia's patients.
Well, we promoted the expo a lot,
Thank you.
I mean, your magazine go like bread.
And yet, I'll tell you something else I want to say.
The more you give me, yesterday I was looking for a magazine for that lady, Rita, and I'm looking all over. I couldn't find a magazine. I said, we have to have some. So I went to my desk to get my copy. I said, hey, you got this.
Well, I want to tell you about the radio show, though. When I'm there, people come up to me in swarms. Oh, Anita, I've been listening for 25 years, whatever. I've been listening. I get every morning. I hear Dr. Mencia. I hear these people. I hear this thing. Because I said, I never know who's listening, but they come up. They can't wait to tell me that they listen to the radio show. So
a lot of people,
well, it's because we know. Where else are they going to get this information?
Absolutely,
they get it because it's a friendly voice.
Exactly, and one of the things the audience love, the feedback that I hear when they come to my office, is that they say, there's no information, nothing like that. You guys are not selling anything. All you guys are doing is giving good information out there
in a lively way.
Exactly.
Right, at this time of the morning,
at this time in the morning.
Well, I want to get serious about something because if you recall,
no,
it's not sex.
Serious.
No, it's not sex. It's flu talk, and
it's not sex.
No, it's not sex. Well, it's funny.
The three-letter word.
Sex is great, except if you have the flu.
Exactly.
Leave me alone.
Exactly. If you have the other three-letter words.
But honey, I've been waiting. Leave me alone. I'm sick.
I have a stuffy nose. Get something else stuffy.
But it's funny because
get the handkerchief or stuff.
Yeah, right, yeah, it's not good.
No, the flu. There was a huge panel yesterday, and one of the questions that came out, and I thought, we have to bring it up in the air just to educate our audience, is that when you look at the flu, one of the questions was like, are we at the 50-yard line mark? Are we halfway there, or do we still have a way to go? Did we surpass that already? And the consensus answer was, we are not even close to the halfway mark.
Because you said it was an epidemic. You said it.
Since December, we've been talking about it, and we continue to talk about it. I have my beautiful nurse, Peggy, that came, that listened to us every Saturday morning. And she came in yesterday. She said, I made up my mind. I'm going to get my flu shot. And, she did a great thing because she takes care of so many people. And, she's a nurse. She goes to people home and she makes sure they are well. And the last thing you want to do is, bring a disease to them. So, I'm very proud of her. I hope she's doing well.
But the way, I got to stop and ask you,
She texted me last night, and she says, so far, so good.
What is it that makes people so reticent to have these shots?
Well, people don't want injections, first of all.
No, your injections do not hurt. You don't even know that it was there.
Yeah, exactly. What we have to look is like by avoiding the injection as a society. Right now, we have 48 states affected, and the number of deaths keep climbing. And what is important is the number of patients with pneumonia is rising. It's incredible. The number of people with pneumonia is rising. And one of the things that I'm doing with my patient, I'm very aggressive with the flu. Because when I know it's a regular flu season, I am not. But this year, I have committed myself that I will avoid having my patient ending up at the emergency room at the hospital or an urgent care center. I don't want them admitted because of the flu or the complication of the flu. So the other day I was talking to one of my patient, a young guy, 69-year-old. He stayed at home most of the time, and he got taken by the flu. He couldn't even leave. He said, I had to get somebody to drive me over, for you to see me. And, 69, this guy drives himself usually. And when I saw him, he was at the beginning of having bronchopneumonia now. So we gave him an injection right then and there. We gave the friend that drove him over, said, go across the street, get this antibiotic. So we get started. I went up to the dental department, got some antibiotic from the dental department, and brought it down. I said, you're going to take this right now. Wow. And 3 consecutive days, he kept coming to my office and got 3 injections back to back.
Of antibiotic.
Of antibiotic. And we aborted the pneumonia. And we were treating the bronchitis. So part of the treatment, I said, I'm going to send one of my nurses to come over to your home and monitor you. 69, he said, I don't need a nurse. I'm still young. I said, you're still young, but you can still develop pneumonia and die.
You die.
So,
I want to talk about that because, we don't do things like that usually on our radio show. But you told me that when you were saying about how many people are getting pneumonia, getting the flu, then they get pneumonia, and dying.
And dying, absolutely. And that's why, when we talk about getting the pneumonia shot and the flu shot is to help us control and prevent this kind of situation that we are going through right now. And if we look, whenever a society or a country going through an epidemic, it's usually because most of the people that should have been vaccinated 2 or 3 years back never got the vaccine. So we become more vulnerable to infection. So it should be an eye-opener for us so that we, as an individual, that take responsibility for our society, say, well, let me go ahead and get my flu shot, whether the media is saying that it's going to be a okay flu season or a bad flu season or a not so bad flu season. Regardless, if you should get that flu shot, just get it. Get it early. And to my patient, before the snowbirds start coming down, one of the things that I was doing very early on, I started giving the flu injection to my patient. I said, I want you to build up the immune system. So when the snowbird come down and I start giving the flu shot, at least you are prepared. And I have noticed a lot of my patients that did get the flu injection early on in the season, they are doing very well, even though there's so many infections going on. So it goes to show that the vaccination can be a great way to prevent all the complications, including death.
Can we? So, how does someone know they have the flu?
You get that runny nose. You get that you sore throat. You start coughing. You have that cough. Sometimes it's a dry cough. When the cough, a lot of people don't like to look at the sputum. They think that's nasty to look at their sputum.
If it's yellow or green, you're
exactly.
in trouble, right?
If the sputum is whitish, it might be part of the condition that we call still a viral infection. But we have to keep in mind, even though the flu is a viral infection, we all have bacteria within us. It's part of what we call our normal flora. So those bacteria, they tend to overgrow. Just like when you take a lot of antibiotic, people can have fungal overgrowth and get a fungal infection because you're taking antibiotic for a prolonged period of time. So, the fungus and the bacteria and the viruses, they are all coexisting in there. And the strongest one will overgrow. So sometimes when you get a flu episode, You can just go through the flu, take some medication to help speed up the process, or you can take nothing, just water, rest, Tylenol or ibuprofen to control the fever, and you might be okay. But when you start seeing that the sputum now is turning yellowish and greenish, if you are a smoker, it's better to be seen. Go to the doctor, get checked. Because if it's an upper respiratory infection, if it's sinusitis that you're developing right along with the flu, because that's the thing, you can have the flu and you can have a coexisting infection like sinusitis or bronchitis. So if it is a coexisting infection, that infection needs to be treated with antibiotic. And that's where the doctor needs to spend some time, check for your lymph nodes, if you have any enlarged lymph node. Check the sputum, do a culture, just to make sure that you are not getting those other infections that will coexist and are the one that's going to really kill you. Because the flu by itself tend to be very aggressive in the extreme of life, the very young and the very old, and everybody in the middle, they can have the flu plus have a coexisting infection. See your doctor.
So let me say this, that Dr. Mencia makes a big effort to come here. He personally comes here every single Saturday morning in the flesh, as we say.
It's not a big effort. I love to come here. I look forward to coming here.
I look forward to your coming here. Dressed in the flesh.
If my mother was alive, she would say, I'm so happy you're doing that radio show. You don't have, because when people ask me to go out on Friday night, I say, I can't. I have to go.
I can't either. Friday night, I'm in bed, right?
I'm stuck here.
Friday nights are stuck nights. But Dr. Mencia, let me give you his phone number, and he is open on Saturday. Please, if you're a loyal radio listener and you have not had your flu shot, and you can get down to Dr. Mencia, that's the place to go.
And we still have plenty of flu.
Yeah, that's the other thing, right?
We order some more just to be safe.
And you really should go do that. So the number there is 954-489-1345 to make the appointment. They'll get you in for a flu shot, I'm sure. Please go and do that. That's going to make us very happy. Okay, but the thing that we want to talk about today is something that's really interesting. In fact, if you go to Boomer Times and you get into the article, I thought it was pretty important. And Dr. Mencia did not know that I was putting this article in the January issue, but it's about people who are snoring and can't get sleep. And you have some right? Don't fall. And that's what it sounds like, doesn't it?
Yeah.
When people, is that what it sounds like?
That's what it sounds like.
That's amazing.
And the thing, you get the people, they're sleeping and then suddenly you look and the person stop breathing. And they are not breathing. And they are truly not breathing. There's no air going through. And it's called sleep apnea.
And what makes the air then start to come through again?
Well, then what happens as you start going to lower oxygen, the brain will kick in and will wake you up so that you can, when you have sleep apnea, you never can fall into a deep sleep. You will die. And some of the one of the complications of sleep apnea is sudden death. And those people that have sudden death, usually, if you drink before you go to sleep a lot, you drink a lot, or if you drink and you take a tranquilizer or you take a medication to help you sleep at night, then you wake up really tired. Or you can have sudden death because, the brain is trying to wake you up, but the pills that you have taken will not allow you to respond to the brain stimuli, and you die. Wow. So the complication of sleep apnea can be detrimental, and a lot of us don't even know that we have sleep apnea unless you live with somebody. If you live alone, you might have no idea you have sleep apnea. But if you listen to this show today, I will give you some tips that you can recognize those tips, and then you can say, I might have sleep apnea.
Yeah, because you're right. If you live with someone, they'd say you're snoring, and that's easy.
Right.
But if you live alone, right. So what is it?
Well, a lot of time, if you watch somebody with sleep apnea, Like when, patient go to a lab. Now we have devices. We can even do the study from home. Because some people, I hate to sleep in another bed. Even like when I go to a hotel.
I don't want anyone watching me.
Yeah, exactly. And then, they are watching you. And, I say, I want to sleep anywhere I want to. If I want to get off the cover, I want to do it. If I want to go back under the cover, I want to like, oh, my God, they're watching me. I better behave here. So there are equipment now that we can use, and we have those things available at our center. There are equipment we can use to evaluate the patient at home. And when we do the evaluation at home, then we can determine if you really have sleep apnea. But what are let's talk about one of my patients I saw this week. One of my patients I saw this week, she came to see me because she was somewhat depressed because she lost her job. So we were talking and said, what happened to you? Why did you lose your job? He said, the economy. She said, no, they thought I was too lazy. And she's a little bit chubby. And I look at her neck circumference, the size of her neck, and it's a little bit big. And I say, how do you sleep at night? She said, I'm not here for my sleep. I say, I know you are not, but so I'm trying to get into the topic. I say, sometimes depression can affect your sleep. So how do you sleep at night? She said, I think I sleep well. I say, how do you wake up? She said, I always wake up tired. And I say, well, let me ask you. When you are at home on the weekend, when you are not working, if it's 10 o'clock in the morning, do you feel like taking a nap? She said, most of the time. 10 o'clock, 1 o'clock, 3 o'clock, I don't care. If I can take a nap, yes, I want to take a nap. And
excuse me, how old is she about?
She's about 28.
She's a young one.
Young woman. She just lost her job. And I say, well, I can write a book on the root of laziness, because she's not really lazy. And before I do the study and everything, I say, we're going to set you up. I think I know what your problem is. You have sleep apnea. And, it's a young woman, single mother, live by herself. So, nobody's there to tell her that, you snore at night. But she basically fit all the thing, what we should be looking for. If you have excess daytime sleepiness, which is called hypersomnia, you feel like throughout the day, even though you think you got a good night rest, throughout the day you want to sleep. If you have episode of breath cessation during your sleep, so you are breathing normal, and then you or somebody notice that you stop breathing, and you have to wake up to catch up your air, to take a deep breath. And if that happened, then those are some of the very common symptoms. If you have abrupt awakenings associated with shortness of breath, if you have morning awakening with dry mouth and sore throat, because you are there, instead of you are because your muscles are so relaxed that they are closing your airway. And do you know, when you have sleep apnea, the airway can be shut down? It's like, people going underwater. People can break a record by saying how long you can hold your breath. Right. And when you have sleep apnea, you are one of those competitors. You can hold your breath sometimes for 5 minutes, for
Amazing.
8 minutes, 10 minutes. And this happening throughout the night. So you wake up with dry mouth and sore throat. If you wake up with a morning headache, it could be related to sleep apnea, because the headache comes because you are not getting enough oxygen to the brain, and those blood vessels tend to contract and dilate and give you that type of headache. If you have problem paying attention, like this young woman that was accused of being lazy, so you have problem paying attention in school or at work, or with your significant other throughout the day. If you have difficulty staying asleep, because when you have sleep apnea, the fact that you have low oxygen in the blood will not allow you to go into a deep REM sleep. If you snore loudly, that's a big one, especially if you have people around you. Now, having said that, not everyone who has sleep apnea snores. So because you live with somebody and they don't snore, if you watch them and you notice that their chest is expanding normally and suddenly they stop breathing, they might not snore because they have good control of the muscle of the throat, the uvula, and they have a small tonsil and what have you. And they might have enough muscle up there that they might not produce the snoring that we look for. Okay?
So the other tips are the things that if someone's very tired all the time, so they may not snore, but those are the other kinds of things.
Those are the other,
what
exactly.
is the most important? You think it's that they're tired? What would be the one thing that could be a hint that they're tired
that
during
they are
the day
tired, they have
after
low
they've slept?
energy, they have low energy, their sex drive drop, they feel like they are, sometimes they get confused with having memory problems, sometimes they get confused with being depressed. They are not depressed. They just, they are not getting enough oxygen.
So someone comes into your office, as you did with this nurse, or no, it wasn't a nurse, it was this other woman, I'm sorry.
Yeah, the nurse was the flu.
Yeah, the flu, right. But no, the other woman comes in and you immediately start to, you diagnose, because that's what you're so good at. And you diagnose what they came in for probably isn't what they really have. And you've talked about that a lot. And so you're noticing that it's the sleep.
Exactly.
And if you don't sleep well, I'm not the doctor, but I've been around you enough to ask you this question. Is it possible then that you'd be more prone to get the flu if you're tired and you're not sleeping?
Of
you get
course.
disease?
If you have, of course. Once you have low oxygen, oxygen is life for human. So oxygen is life. And bacteria, you have two types of bugs out there. You have what we call aerobic, those ones that love oxygen like us. But then you have the anaerobic, the one that they do much better when you have low oxygen. And they are much more difficult to treat. Those are the ones that can kill you, the anaerobic.
This is a very big subject, isn't it?
Absolutely.
About sleep apnea. So what should people be doing now about this? They should come?
They should come to and get an assessment. Okay. One of the things that we are doing, because I'm so lucky to have all these specialists working with me. I have now 3 dentists working at my center, and I have 2 of them getting trained on sleep apnea, because I want to get my dental department involved. Why, you will ask? Why would you want the dental department? Because my patient have taught me that the traditional approach to treatment of sleep apnea is not working. A lot of patients, they have great insurance, and we get them the CPAP equipment. And if they go to the article, they can look on that page what is a CPAP, and that's the picture that have the machine on.
It looks very scary, frankly.
Exactly. It looks like you're going to go on the water. You're going to go diving.
If you have the magazine there for January, it's page 39. It says, say to get more Z's. Dentists help patients say good night to sleep issues.
Right. So what we are doing now, the latest thing we are doing is putting a mouthpiece so that we can control those muscles that prevent you from getting the oxygen. Because sleep apnea can be deadly. It can kill you. And having that device, it will do several things. It gives you dignity. Because if I'm at home and my family is with me, the last thing I want when my kids come to bed that they want to sleep with me is say, oops, wait, I had to put on my machine.
Oh, no way.
I don't want that. If I can just put a mouthpiece on and my kids can come and lie down next to me and all of that, then I think I'm more of a human. So that's one of the things. The same if you're going to make love, probably you want to take it off.
Oh, I would say
it's a device much easier to take off than a mask.
Oh, yeah. No, but you're right. I mean, I looked at this. I really hadn't ever seen it. But in this article, I said, that's horrible. I can't even believe that you have to go to sleep.
Machine. And, I tell you, one of the reasons I started investigating is that when I see that something is not working, I say, there have to be a better way. And a lot of my patients that have sleep apnea, and when I'm talking to them and I say, maybe sleep apnea, I say, no, I do have sleep apnea. I say, you never told me. Oh, yeah, I already did all the tests. They gave me the machine. Well, how you doing with the machine? I don't use it. It's in the closet. It's in the garage. I don't use that stuff. I don't want to use that stuff. And then you tell them, well, there are more modern machines we can get. I don't want a machine. I don't want something on my face because it just does not work.
Let me just say one thing. So this is actually an oral appliance that you're talking about.
Yeah, it's a mouthpiece. It's a little mouthpiece that you put on. People don't know that you have that on when you're sleeping. So if you have your significant other, you just open the little mouthpiece and put it on, and you look completely normal.
So when we've been talking to Dr. Mencia, of course, we talked about the flu, we talked about other medical problems, but their dental department is expanding because they've had so many people. Do you know that Dr. Rosemary called me and said that two people called from down in the South Broward area because
they came and they got the treatment. They came and they got the treatment. They really love the center.
Well, Dr. Rosemary is fantastic.
I encourage everybody to come and look at the center. We're going to have the open house coming up.
Oh, yeah, we didn't talk about that. The 22nd, I believe, right?
So for people that are reluctant,
February. Well, I don't want anyone to worry. It's February. We'll be talking about it. We're going to do a commercial or something. February the 22nd. We're all going to be there. We're going to have a big party. I can't wait. It's so exciting.
It's going to be great.
Yeah, we're going to do that. But you have really expanded, and I know that it's important to you. But the dental department is something now. They're going to have the very latest of everything there. But the sleep apnea is what Dr. Mencia really came to talk about this morning.
People with sleep apnea, they can develop. Because, some people, they are so afraid of atrial fibrillation. You can develop atrial fibrillation.
Can you really?
Of course. You have low oxygen in the heart. The heart can, take off and go into atrial fibrillation, congested heart failure. We spoke about sudden death. We can have a stroke. And you can have high blood pressure. And a stroke and congested heart failure can be the cause of sleep apnea, but also sleep apnea can produce congested heart failure. And when you have that combination, that's bad because it can become a vicious cycle.
I think when we have the seminar, I really hope that, I know it's going to be a tour and everyone's going to see everything, but I'd like people to see the difference maybe of what a CPAP looks like and then what the appliance looks like.
That's a great idea.
Yeah, because they're just afraid. I mean, frankly, if I came to you as much as I care about you and you told me I had to do that machine, I wouldn't do it. I'm sorry.
A lot of people that take the machine home, they try it, and most people just put it away.
Yeah, it's really overbearing, but I would.
And then imagine if you have to travel to see your kids.
Oh, forget it.
You have to carry that.
No. Yeah,
it's like being a ventricular. You have to carry those extra luggage.
Right, but this is pretty new, isn't it? Isn't this pretty new?
That's the latest thing. And next week we're going to have one of my dentists that specializes on this.
Okay, so he's going to be on the radio.
He's going to be on the radio.
We're
going to do a show.
So we're very excited about it. Well, Dr. Mencia, thank you again. Of course, you're open on Saturdays. If anybody hasn't had
we have plenty of flu. Come and get it.
Yeah, come get the flu shot, and you'll get a hug from Dr. Mencia. That's probably the best medicine of all.
And Richard got a free flu shot, so whenever he wants to. You know that.
Flu shots are really important. We thank you so much, Dr. Mencia, as usual. And everybody go. As they say, y'all come. Saturday, the phone number to call is 954-489-1345. It's called the Adult and Geriatric Medical Center. It is over there at 1608 East Commercial Boulevard. It's just a little bit west of
and
Holy
we do
Cross.
ear lavage.
You do what?
Ear lavage. And we clip nails. And we shine teeth.
I know. You do everything.
We do
but
bright
the best
smile.
thing, I know, the best thing are your hugs.
Yeah.
I tell you get a hug from Dr. Mencia. He is the most positive person. He could be anything, and we love the fact that he's our
I think that's the
doctor.
best treatment of medicine.
Yeah, it is. Well, I know that, and you do that.
Yeah, love and sincerity.
Yeah, he's wonderful. Thank you so much.
You're welcome.
We'll see you later. All right, we're going to take a fast break, and then we're going to go to Leslie Curtis with Whitehall. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.